So then I would like to invite Damon Barrett to speak for us. Damon is the co-director of the International Center on Human Rights and Drug Policy, which he co-founded in 2009. He is an associate senior lecturer at the School of Public Health and Community Medicine, Sahlgrenska Academy, University of Gothenburg. We are curious to hear you talk about child rights in global drug policy. So, welcome.
Thank you very much. So I have the same disclaimer that Mick made, which is I wasn't sure what others would say, but I actually think what I have to say follows very well from both the speakers that we've heard so far. As I think I'll touch upon rights issues, I'll touch upon some legal issues, and I think hopefully I'll be reminded to come back to the meaningful engagement of people who use drugs in all of this. But I think we need to start with a simple question that I ask students all the time when I lecture about drugs, which is, what's drug control for? And it seems like a silly question because students sometimes think it's a trick question. It seems so simple. Leaving aside for a moment, if I may, what might be the less visible aims of drug control that Mick raised, drug control is a global, decades-long intervention to protect people from addiction. That's the ostensible aim of it. Whether it achieves that is a totally different question, of course, but that's the ostensible aim of it. Now, when did children enter the picture? And what was that all about? That's a much more recent thing. In my own work, we see it coming up more in the UN system around the early 1970s, and really only in the 1980s does this idea of protecting children come into the picture. You hear in policy debates children referred to as our future and our most precious asset. You might have seen this kind of language, and it's that kind of abstraction, as if children are something in the future that need to be protected, that I think we need to get away from. In the 1988 Drug Trafficking Treaty, the only one of these 3 UN drugs treaties that mentions children explicitly, it says that the drug trade and using children as an illicit drug users market, strange wording, right, is a danger of incalculable gravity, it says. That was adopted in 1988. In 1989, we get the Convention on the Rights of the Child, which has an article in it about protecting children from drugs, which makes it different from the other human rights treaties we've got. And it explicitly refers to those drugs treaties, so it connects the two systems. Now, states, Mick mentioned the death penalty. States have used the UN Drug Trafficking Treaty to defend the death penalty for drug offenses, probably most obviously in Indonesia in a court case about 15 years ago. But what's more interesting, that seems actually obvious to me, because it says that there should be stringent penalties in place. But what's less obvious and more interesting to me is that in my research looking at the UN Convention on the Rights of the Child, states that have the death penalty for drugs also defend it with reference to their child rights obligations. They tell the UN Committee on the Rights of the Child that they use the death penalty against drug traffickers to protect children from drugs, right? Now, that's an extreme example, but that doesn't make it less real. States also tell the UN Committee on the Rights of the Child that to protect children from drugs, they have stringent penalties against drug users, against drug traffickers. They tell them that they have, quote, an out-and-out war on drugs. That was what China said a number of years ago. They report urine testing, use of drug user registries, removal of custody from parents. They report all of these things as a way to protect children. And other states report their progressive policies. Of course they do. So basically what's happening is states report whatever they happen to be doing to the UN Committee on the Rights of the Child as fulfilling their child rights obligations. So I have another question. Not what's drug control for? What are human rights for? This one's a little harder, I think. But I think it's safe to say that human rights are not there to blandly support whatever the authorities are currently doing, or whatever they want to do. That's not the role of human rights. That would destroy their character. Human rights regulate, this comes back to something that was said in the first talk. Human rights are there to regulate my relationship with the state because of the amount of power the state wields over me, right? They're there to look not only at what states are aiming to do, but the means they use to get there. So sure, of course, we should protect children from drugs. Has anybody got any problem with that statement? It's so obvious that we don't need to restate it. What the human rights framework should do is look at what states are actually doing and assess that from a human rights perspective. And we have tests and we have standards and we have norms within the human rights framework to do that, but it can't be done in the abstract. It has to be done on specifics and in context. So this is why we have to get away from this idea of, quote, the child or the collective children as this future or this collectively owned asset that we're protecting somehow. We need to look at the specifics and go from abstraction and this kind of broad, go from the child as a concept to children, individual kids, as human beings. Now, I was at the UN General Assembly with some colleagues that I'm delighted to be back in person with again, back in 2016 at this special session on drugs, and there was a panel on everything that they weren't talking about in the main session. Women, children and youth, marginalized, they just lumped them all into one side panel. So we had this panel, and I asked this question. I said to all the states, can anybody explain to me how criminalizing a parent is in the best interests of their dependent children? The best interest of the child being a core principle of child rights law. Now, it could be that someone had a reason, and they could say, yeah, it's in the best interest of the child for their parent to be denied employment, to have their life chances damaged. That would be in the best interest of their dependent children. I didn't receive any answers to that effect, but it's possible. Another thing that could be argued is that the state or societal interests in punishing a certain kind of behavior outweighs the best interests of an individual child or some children. That's possible, you could argue it, but transparently explaining yourself is also part of the principle. We would have to explain why that reasoning was reached, why criminalizing drug use outweighs the best interests of those children. Let's look at the other side of the supply chain. We want to protect children, let's face it, we have an idea of children which is a global north or a Western concept of the child, and we say, to protect those children, we're going to eradicate crops in the global south primarily. Well, what about the children affected by all of that? All of those children on the supply chain in order to protect these children over here. Is it of child rights significance that a family smallholding somewhere in Colombia is destroyed and their monthly subsistence is ruined for this idea of protecting us all from drugs and protecting children from drugs? I think it is. And what would a child rights assessment say of that activity? Of course, the big question, coming back to mixed talk, is we talk a lot about children's exploitation in the drug trade, but are opportunities for exploiting children increased or decreased by criminalizing the whole market? It seems to me that it must increase. I have to just answer that question without being the kind of economic analyst that's required for all of the quantitative data that would be required there. It seems to me that opportunities for exploitation are higher and increased within a criminal market. That's of child rights significance too. We call involvement in the drug trade a worst form of child labor, but that's because of its criminality and all of the danger associated with, say, for example, children's farming on a small holding. It's dangerous because it's criminalized, and what states do to respond to those illicit crop growing. So, just like in harm reduction, in human rights analysis, we have to separate out drug harms from drug policy harms. And let's call drug policy harms what they are. They are political choices. A choice is made to weigh certain things more than other things, and we need to make that transparent, and we can apply human rights language to those choices. I think that's important to do. Now, I was spending some time in another part of the world there at a Nordic conference. So let's look at Sweden for a moment, where I live, a country I really love living in, I have to say. Much lauded on one side of this contentious debate, and not so much on the other side of the debate. I tend to think the reality is somewhere in the middle, like it always is. There's been some really good news recently with naloxone distribution improving. It's not great yet, but it's at least improving. We have far more needle exchanges than we had before, and there's at least a discussion going on about reforming the laws, or at least, not reforming, excuse me, at least evaluating them. The Public Health Agency, everyone knows Sweden's Public Health Agency these days, is in favor of at least an evaluation, including our criminalization of drug use. The government's not interested in that part of the evaluation yet. But let's look at Sweden. I'm working at the Sweden recently adopted the whole Convention on the Rights of the Child into national law in its entirety, including the article that refers to drugs. It's Article 33, if anyone wants to look it up. So, in typical Swedish style, a huge evaluation was requested to see if Swedish legislation is in conformity with the Convention on the Rights of the Child. It's it's something like 2,500 pages long, this thing. It's absolutely massive. And there is a chapter, necessarily, on the article about drugs. And it just says, yes, broadly, Sweden is in conformity. The only recommendation is to maybe include a new crime of encouragement or incitement to use drugs, which Sweden doesn't currently have for freedom of speech issues, right? So, but that is actually recommended in the UN Drug Trafficking Treaty. Anyway, I'm not heavily criticizing the report. It's a couple of thousand pages. It's a huge undertaking. It's quite impressive. All I'm saying is that's not the kind of specifics we need. I'm working currently on a project across Sweden, Switzerland, and the UK, looking at injecting drug use among legal minors, those under the age of 18 who begin injecting drugs. Now, there's not that many of those in Sweden, but from a human rights perspective, that doesn't matter. So you're looking at each individual's situation. And as part of that, we were doing a legal and policy mapping, and in Sweden, under 18s are not legally permitted to go to the existing needle exchanges. It used to be those under 20, now it's under 18. So I was looking at the official rationale for this, and I was expecting to find just a kind of political queasiness or uneasiness with allowing legal minors into that kind of service, but I found something far more interesting. The rationale for it is that if somebody under 18 is injecting drugs and they attend a health service, the health service is under a legal duty to report them to social services, which could then lead to compulsory institutional care. So, to allow children, and I say quote-unquote children, you're talking 17-year-olds, right, into that service would introduce coercion into what should be a low-threshold service, right? So the answer is to make the threshold so high for these few people that they just can't go. Now, my thinking was this: okay, well, let's apply a child rights analysis to that. If somebody's already injecting drugs at the age of 17 and presents at a needle exchange, isn't that a positive step, right? From a harm reduction perspective. And could it not at least be considered that it might be in their best interest to access that service? So that we consider that we have a principle of the best interests of the child, right? Again, I know 17-year-olds and 16-year-olds might not like to be called children, but just legally speaking. And then we have another principle, on the other hand, of retaining the low-threshold nature of the service. That's the kind of specific discussion we need to have. Not, we need to protect children from drugs, we need to retain a drug-free society, therefore keep all kids out of this service and make sure that they never begin using drugs in the first place. The children turning up at those services, or if they would, let's face it, some of them are not that attractive because they're very medical, they're made less visible by that conversation of a drug-free society, because they're living in their world, in their life world, as some researchers would call it, within which drug use is there. The drug-free society doesn't exist for them. So I leave that question open. I've had this one slide up the whole time, so let me talk about it. I've been working for the past few years on what it means to incorporate human rights into drug policy. So we've been working with the support of the UN Development Program, funding from the German government and the Swiss government. We've been applying human rights law to the broad spectrum of drug policy, from supply through to use. And we created the international guidelines on human rights and drug policy. We had consultations in, I think, every region. We had consultations at the AIDS conference with Input back when it was in Amsterdam. We're still consulting because we're now looking to implement these things. We've taken decades of human rights law and applied it to drug control. But we tried to stay legal, so we're still restrained by the UN drugs treaties because we can't pretend they don't exist, and states won't pretend they don't exist. But we've tried to moderate what they say by applying human rights law to them. And of course, there is a section on children. What these guidelines can help to do is operate as a standard or a normative baseline for accountability. Because that's what we need. We need to move from this use of children as a broad justification for whatever states want to do to child rights as an accountability framework for what they're actually doing and actually achieving. So I invite you to investigate these on your own. That's the website. It's entirely searchable. We didn't put it all into one big PDF. And it's going to grow over time too. But we're already seeing some success with these. They've been used twice in the Colombian Constitutional Court already to deal with some policing practices. We did some training with judges in Albania, and a judge has already told us that the training helped her to keep 2 people out of prison already a couple of months after doing the training, just allowing her to pay attention to her whole legal system and what opportunities were open to her to leverage other parts of the law to mitigate the very stringent criminal laws in Albania. We're going to be working, we've been discussing with Input, in fact, about how we can incorporate the guidelines into their work at national and regional level moving forward. Now, human rights work's not easy. It's often controversial. Human rights law often says things that states don't want to hear. But there's a quote from Professor Philip Allott from the UK that I like to use, and he says that the idea of human rights should intimidate governments or it's worth nothing. If the idea of human rights reassures governments, it's worse than nothing. And I think that's something that I always try and carry with me. Because accountability is not to be found in using human rights as window dressing for whatever governments are doing, and that includes the protection of children from drugs. It's to be found in the specifics and in the context. Thank you very much.